Over the past 15 years, Riverside Methodist Hospital has experienced a 35% increase in its number of emergency room patients. That's partly due to the population boom in the greater Columbus area and also reflects the nationwide trend of rising emergency department volumes. To better meet the needs of the Central Ohio community, Riverside is about to unveil a brand new $76 million expansion dedicated to emergency services and heart care. Chris Weber has more.
It may not look like it today, but in less than 2 months, several years of planning, designing, and building will culminate in an emergency services heart care facility unlike any ever seen in Central Ohio.
I think the biggest thing about this facility is its focus on the patient and the family. We've gone to great lengths in our design process to make sure that whenever possible, we're bringing services to the patient instead of the reverse.
In addition to increased comfort, safety, and privacy for patients, the new facility has been designed for maximum efficiency, getting critical care to the patient as fast as humanly possible.
If you imagine a patient who's experiencing a major heart attack, it really just doesn't get any better than the design that we've put forth in this building. Those patients will be immediately resuscitated and diagnosed in the emergency department and literally put on an elevator where they have immediate definitive care in terms of heart cath labs and other heart services that they need on the second floor of this building.
Riverside's new emergency department will take advantage of the latest advances in wireless technology with things like wireless cardiac monitoring, wireless bedside registration, and a cutting-edge wireless voice communication system.
It's almost like what you see on Star Trek, talking into a monitor or a small instrument worn around our neck that you can ask for a nurse on the other side of the emergency department just by asking her name, and it'll focus just on her communicator, and I can talk to her directly.
Riverside's new emergency department will feature, among other things, improved diagnostic capabilities including radiology and CAT scan, reverse airflow quarantine rooms for biological or chemical decontamination, an improved helipad, a quiet, comfortable lounge for EMS medics to fill out their reports. But again, it all begins with the patient.
There are no stretchers behind curtains in this new emergency room. Every room is private. Every room has space for the families. Every room has television available for the patients. These are all features that just don't exist in the current emergency room.
The current Riverside Emergency Department was designed to handle 45,000 to 50,000 patients a year. But lately it's been handling more like 75,000. The new facility will double the original capacity, allowing Riverside to handle upwards of 100,000 emergency patients a year.